For centuries, there has been a legend of a land untouched by time. Authors have written about it. Explorers have vanished searching for it. And one man will set out to discover the truth.
A journey to the center of the earth.
It wasn't just science fiction. It's inspiration.
Come on, boys.
Don't worry, looking good.
Direction is my sixth sense.
Watch out!
Nice guy. Nobody moves. Slightest change in pressure can cause it to shatter. It's actually thicker than I thought.
I have set out on this dangerous journey, a journey through the optic nerve head pit to the center of the eye. This was a 12-year-old girl who came to me with decreased vision for the past few months. That is when I saw the truth. There was a large optic nerve head pit with submacular fluid. I had to take the plunge, the ultimate plunge, lest no man shall fall like before. The hole had to be plugged. We started off with anterior vitrectomy. PVD induction is the next step. As you can see, the vitreous is quite sticky. One go, two goes. The vitreous is not detaching. This is the problem with most of the optic nerve head pits. These are young patients, the vitreous gel is well formed and it is very difficult to induce a PVD. Most often, we take the help of dyes or steroids like Tricot to induce PVD in such situations. This is being shown just to make you aware how difficult PVD induction is in such cases. The actual procedure may not be difficult, but in many cases, the initial step of PVD induction is what that changes the game. The vitreous is so adherent to the macula that whenever you go near the retina with the cutter, the retina tries to jump into the cutter. Just imagine what will happen if you create a macular hole in such a situation. And with sustained effort, I could develop a cleavage there close to the macula. And as you can see in this video, over a period of time, I could manage to induce a PVD. It is always advisable to use a high magnification in such cases so that the visualization of the posterior hyaloid and cortex becomes more effective and things are more under your control when you're doing such cases. Now you can see the PVD is partially induced. And again, the PVD gets induced above the disc. Now you go ahead with the peripheral vitrectomy. Here we try to clear off the vitreous beyond the equator. The next step here is ILM peeling after staining with brilliant blue G dye. We always do a fovea sparing ILM peeling in such cases. Next is to harvest the scleral patch graft. We use the infranasal quadrant and take out a 1/3 thickness scleral patch graft for such cases. You can see the graft is slowly harvested. There will be some bleeders which may have to be cauterized in many of the situations. The graft is put in saline. It is taken inside the eye and slowly positioned in the optic nerve head pit. You can see the graft going in. Thus, we first do an FGE and then try to position the graft. This helps in better positioning of the scleral patch graft and prevents late displacement. This is yet another case of ONH Pit RD. Here, we have done the technique in a slightly different way. We start off as usual with PVD induction, but in this case, the ileum was peeled all around. It was bunched at the fovea, as you can see subsequently. Here, we had to do a tricot stained PVD induction followed by vitrectomy. Now comes the step. You can see the ileum is peeled all around the fovea. Just as we do the inverse flap technique, I am trying to bunch the ileum centered in the fovea and leave it there at the end of the procedure. This is also a form of fovea sparing ileum peeling. The next difference here is I am trying to put in the scleral patch graft even before FGE. If you are trying to do that, it is always better to off the infusion. Now, this is going to help in two ways. With the infusion on, if you're trying to position the graft usually doesn't stay, it tries to move away. Now you can see I'm tucking the graft with the end of the cutter into the optic nerve head pit, and then I start the FGE. In the end, you can see the graft is well in position. Now these are the post-op results showing good positioning of the graft. You can see the OCT showing the graft in the ONH pit, and this is almost resolved submacular fluid after surgery. Thank you very much for your kind attention.